Hey, Justin.
Hey, good afternoon.
Yeah, I need to set up a time to meet with you and figure out, all the details of what you're doing because there's a lot of overlap, and I keep thinking I need to sit down and talk to you. And after deck, I was trying to trap you, but then Kenny grabbed me, so everybody left.
Oh,
But
okay.
yeah, I need to set up a time and just kind of understand more about Oka.
Sure. Sounds good. Yeah, let's set that up.
Yeah, I'll have Kanoe, who is temping over here as a secretary, help set it up.
Okay, great.
Yeah.
Jack, it might be also good to include Gina.
Okay.
So Justin, he's currently in the acting position, but he oversees the state licensing side, and Gina oversees the Medicare side.
Oh,
So I
okay.
think you want both perspectives.
Thank you. That'd be great. Yeah, that'd be excellent. I've a nightmare may be upon me because I have a feeling that I'm going to be asked to figure out how to streamline the whole licensing side of DCCA, which, yikes, that's tough stuff. and, and I'm, woo, that's not going to
Mhm.
be easy.
Okay, well, we're going to start because it is the bewitching hour. Aloha, everyone.
Well, Senator.
Hi. Hi, everybody. We have a very interesting topic today, the start of a conversation that we did a little bit of talk about. And I know that just welcome everybody. I see my partner here, Corey Chun, Representative Chun, is co-convener. So without having as much time as we can, without going through a lot of announcements or anything now, and we'll do it at the end. I'd like to just kind of set the parameters. John McDermott is on too, and brought to our attention these unlicensed um, community care homes, and it was in civil beat, and so of course it raises our kind of flags. And so we circled to DOH OCA, and I'm so pleased that Justin Lamb is here and can give us some background. This is the start of the conversation, and I'm going to turn it over to Justin and also Debbie Morikawa, so that we could start the conversation. It's a complex area, but I found out through Justin that there is a law that that allows us to do inspections unannounced, and the law is clear that it's zero tolerance for unlicensed homes. So, go figure. So the conversation is starting, and so one of the next steps would be to talk with the AGs and see how we can get this law to be implemented. But before we start that, some background. I'm going to turn it over to Justin, and then we can have discussion, questions, and answer thereafter. So, Justin, it's all yours.
Well, thank you, Senator. Thank you for inviting me, and a huge thank you to everybody for attending today, and those of you viewing online on YouTube. Thank you for being here. So I'm going to go ahead and share my screen because I do have a PowerPoint presentation to talk about. And for those of you who don't know me, I'm Justin Lamb. I'm the acting chief of the Office of Healthcare Assurance. We're with the Department of Health. Sorry, let me drag this down. Sorry.
Hmm.
Okay, can everyone see my screen okay? Okay, great. Thank you. Okay, so today I'm going to discuss what I'd like to call the unlicensed care home dilemma. Today I'm going to be talking about kind of how the country was pre-licensure requirement, the different types of homes that existed back then, some of the history regarding the need for licensure. Then I'm going to talk about our office. We're the Office of Healthcare Assurance. So I'm going to talk about our office, what is regulatory compliance, some of the history behind the creation of our office, what we do, and our role initially, and how our role has changed over time. And I'm going to dive into the unlicensed care homes, some of the problems of these unlicensed care homes, what the public can do, what you can do, and why do people even go to these unlicensed care homes? So a little bit of history. We're going to step back 50-odd years to the 1970s. There was a series of large fires in boarding homes and a growing number of confirmed reports of abuse and neglect. And these were across the country, not only in Hawaii, but it really highlighted the need for monitoring and regulation of these homes. And so Congress stepped in and they added the Keys Amendment to the Social Security Act in 1976. And that act required states to start to meet standards for the homes where SSI was being received in those homes. So at that time, the state boarding home regulations and the care home regulations also started to implement that federal policy. So requiring licensure started around that time. Going back to 1986, so pre-1986, care in these types of homes was split between the Department of Health and what was called the Department of, sorry, the screen's right in the way, Social Services and Housing, which is now the Department of Human Services. So DOH licensed the care homes, and DHS, what's now DHS, licensed the boarding homes. And in 1986, the two homes were combined into one type, which is now called the adult residential care homes. And that's how we know care homes today. Jurisdiction of the care homes falls under the Department of Health. So it was taken from DHS and given to the Department of Health. And then Title 11, Chapter 100, which is our Hawaii administrative rules for these homes, was enacted June 30th, 1986. So I beg the question to everybody. Would you go to a bar without a liquor license? Okay, maybe. You know, if I'm drinking in someone's backyard, I may not care how they made the cocktail. If it's my friend, I trust him. It's my auntie, I trust her. Okay, questionable. Next, would you ride in a taxi without a license? Maybe. If I really need to get home from the airport, I may not question why the taxi cab doesn't have a license plate or a tax number or a driver number, anything like that. If I really need to get where I need to go, okay, maybe, but it's still questionable. Or how about a restaurant without a placard, a green placard from the Department of Health, or any placard at all? How do you know that restaurant is safe? Okay, maybe I'm eating at a friend's gathering in their garage and there's karaoke going and there's a barbecue and I don't really know where that food came from. Okay, I might trust the people. But would I go to a restaurant without a placard? I don't know, maybe. So these are kind of slightly questionable, establishments and places to visit and, without a license, but I'm going to up the ante. Would you take medication that wasn't FDA approved? No label on it. It's just a vial with no label, just some pills you got from a friend, said, hey, my aunt took this and it was fine. Go ahead and take it. Or an injection. It's a syringe, a medication that's not approved by the FDA, no label on it. Just have a friend saying, hey, trust me, this is fine, this works. Or would you see a doctor who didn't have a license to practice medicine? There's a lot of these things that we just take for granted, and these things are normal in our society. But would you fly in an airplane that's not inspected by the FAA? Your uncle built it in his backyard and used lawnmower parts. Would you get in that airplane? Or would you fly in an airplane where the pilot didn't even have a pilot's license? So I think the previous page is maybe, okay, you might take the risk, and dine in that facility that didn't have a placard or something like that. But I think this page is pretty serious. And I think these are unacceptable to most people. So why are these things unacceptable to people, but putting a loved one, a family member, in an unlicensed care home is okay? So I beg that question. So case study. And this was one of the big cases that kind of brought the need for licensure and showing the issues that happen with unlicensed care homes, kind of brought this to the public's attention. So we go back to September 4th, 1979, and this is in Pearl City, kind of near where LCC is. An illegal care home catches fire and kills 4 residents. So they had visited the home and notified the operator that the condition of the home did not meet minimum standards for licensing. They were trying to get the operator to come into compliance. So the state was aware of this home, and we were pushing towards compliance. There was no indoor toilet or shower facilities. They had a small shed in the backyard with a bathtub and a water hose, and it was heated with wood fire. So these are really terrible conditions. But this is just an example of the extremes, of these unlicensed care homes. This is kind of an older example, but just to show an example here. And food was cooked on a kerosene stove outside. So the biggest problem with unlicensed care homes is they have no oversight, no government oversight. There's no minimum standards, and there's no assurance. The state ombudsman can't enter these unlicensed care homes because they have no jurisdiction. And the state ombudsman represents those Kupuna in the community who can't represent themselves. They speak up for Kupuna who cannot speak up for themselves, right? OCA has statutory authority. We have legal right to enter, but we're still denied entry. There are attorneys and other unlicensed care home operators who are obstructing our investigations. So we can't check to see whether things are safe in there or not. There's no consumer protection. Under the licensed care homes, they have what's called resident rights, and these resident rights are written into the Hawaii administrative rules. So unlicensed care homes don't have resident rights. It's really the Wild West. The public can't file a complaint. Who would they complain to? No one's licensing these places, right? So there's no recourse. There's no regulatory compliance and no standards of care. They don't follow administrative rules, they don't follow statutes, and they don't follow the law. They think that they know better and they can do better, and so they just do their own thing. There's also no enforcement. So there's no recourse if the facility is operated poorly. And that's why we have licensing, and there's a need for these facilities to be licensed, just to establish the minimum standards and have some assurance. So what is regulatory compliance? So regulatory compliance is to follow state, federal, and international laws and regulations that are relevant to operations. The laws, or Hawaii revised statutes, and rules, Hawaii administrative rules, are adopted to protect all parties involved. Caregivers and residents have rights, and those are outlined in the Hawaii administrative rules. So why is regulatory compliance important? Regulatory compliance protects the health, welfare, and safety of residents in the facilities that OCA licenses, that we certify and we regulate. And it ensures minimum levels of safety and quality. So what is OCA? So like I mentioned earlier, OCA falls under the Department of Health, and we are the Office of Healthcare Assurance. And these are the various facility types that we license. So in short, every different facility that's a healthcare facility in the state of Hawaii, whether it's a small adult residential care home, all the way to large hospitals and health centers, is licensed by our office. The top 3 adult residential care homes, expanded adult residential care homes, and community care foster family homes. I'm going to dive into those a little bit more just because that's what is commonly referred to by the public when they talk about care homes. So adult residential care homes is a residential home who takes care of residents who require minimal assistance with the activities of daily living for a fee. Expanded adult residential care homes is the same thing as regular adult residential care homes, except they can care for a certain number of residents who require skilled nursing level of care. The community care foster family homes is a Medicaid-based program. They're allowed to have 1 private pay patient, but the rest of the patients have to be Medicaid. And every resident in a community care foster family home is skilled nursing level of care. So those are the 3 primary types of facilities that are referred to by the community and the public as care homes. So our office is broken up into 2 sections, the state licensing section and the Medicare section. And then on this slide is the various different facility types that we license. So some history of OCA. We're going to go even further back in time now. May 16th, 1853. King Kamehameha establishes the Board of Health Commission, which is now the Department of Health. And then prior to 1960, the state pretty much was pushing, had more institution-based type of facilities. You had Hawaii State Hospital and you had Waimano Home, right? Anyone with any kind of intellectual disability, anything like that would end up at Waimano Home. Anyone who was deemed back then, insane or having some kind of mental health issue would be at State Hospital. So the census of these facilities was massive. There were large communities. But in 1960, there was a nationwide push towards more community-based care for older persons. And then you had the federal passing of the Older Americans Act of 1965. So 1960 to 1961, you had what was called the deinstitutionalization here in Hawaii. So there's a discharge of around 2,500 patients from Waimano Home and Hawaii State Hospital into boarding homes. And keep in mind, this is prior to 1986, so the boarding homes were under what was DHS at the time. So OCA was formerly called the Hospital and Medical Facilities Branch, and we became OCA in 1999. As our role changed, our name also changed. So what kind of services does OCA provide to the care homes and the facilities? Well, for one, we have a dedicated nurse consultant who is the point of contact for the office. They conduct the inspections and the visits of the care homes. But the reason why we call them nurse consultants and not surveyors is because they're supposed to be, a middle halfway point between the regulations and the care homes, so they can advise. They're not just a surveyor. They don't just go out and conduct inspections. They're there to help ensure compliance for these facilities. We teach during inspections and visits. We have newsletters and in-services, but we're looking at expanding this aspect of what OCA does. And I've already discussed this with our deputy director and senator on this. And we advise the correspondence with the nurse consultant and the section supervisor. We want to have open communication with the care homes to discuss the different regulations and ensure compliance. And we have outreach. So the need and role of OCA. So facility licensing and certification is in statute, Hawaii revised statute. So it's in law, the need for these licenses and certifications. And there's been several studies that community-based care is ideal to have the home-like environment for the elderly, for the developmentally disabled. People tend to thrive more in a home-like environment than an institutional type of environment. There's a need for OCA for safety concerns. Some of the things I mentioned earlier, fire, structural safety, and things like that. We have a lot of requirements that the facilities have to follow as far as building code, zoning code, fire code, things like that. OCA will help ensure compliance with the administrative rules and the statutes per facility type. And we protect our kupuna through ensuring compliance and educating the caregivers. So how has the need and the role of OCA changed? So initially you had the creation of administrative rules. You had the deinstitutionalization in the 60s. Then you had additional facility types to allow actual aging in place. So you had the establishment of the home care agencies to where home care employees can go in and take care of kupuna in their own homes. So that's a real aging in place situation. And that's where they can really thrive, is at home, in their own home. And OCA, unfortunately, has had to start to take more of an enforcement role and take action against these unlicensed homes. That includes things like search warrants, administrative penalties, and referring to other agencies like tax office, prosecutor's office, things like that. And we have to also take action against negligent licensees as well. It's part of our duty to make sure that we're holding everybody to the same standard, at least the minimum standards established in the rules and the regulations. And we're taking more of a consultation role. Like I mentioned earlier, I really try to foster communication between us and the licensees. So we advise and consult. So we have this kind of change for OCA being a strictly regulatory entity to kind of being a blend of a regulatory entity and an enforcement entity at the same time. So this is more of our current role as far as like a overview. So need for care home licensing. Well, for one, it's required in the Hawaii revised statutes. It's in law that care homes need to be licensed. There's uniform standards for facility types like square footage for rooms, how many residents you can have in each room, restrooms, fire exits, lighting, sanitation, things like that. Another thing too is the need for care home licensing will protect the public from illegal operations and unsafe care homes. Or at least that's the intent of the law. Okay, we have another case study here. So this was May 2022. This is one that I actually worked on. There was an unlicensed home with 3 residents. It was formerly an adult residential care home, but it was only open for a few months, and then they closed. They reported to us that they had closed and that all the residents were discharged. Well, it turns out that they still had the residents there. And there was a conflict between the family of one of the residents and the illegal care home operator. And then the care home operator ended up taking the resident to the family's house and dumped the resident in the carport with all their belongings, in trash bags, and left the resident there without food or water for 4 hours until one of the family members came home. And the family called me so upset, and they were ticked off and they were outraged. And then I informed the family. I said, "Oh, did you know that they closed their care home and they were no longer licensed?" And they said, "Yeah, we knew that, but they said that it was going to be okay. It's not okay because we had no recourse at this point. We couldn't do anything. So why do they go unlicensed? Initially, one of the biggest complaints that I got was that it takes too long to get licensed. It takes years. Now we got it down to 1 to 6 months. It's getting better. We're going fully electronic with our application process. We're having more people review applications. And we're trying to simplify it as quickly as possible to try and get these homes licensed and stop the timeline being a barrier for justification for them running unlicensed. So if that's no longer an issue and no longer a barrier, what are they trying to hide? What is it that they're violating that they don't want the department to go in? Is it a zoning issue? Do they have more people? Do they have more than 8 people in this home? And I have a good case study about that later on. I'll share with you guys. Is it a building issue? Is it an unsafe building where they had a family member do some renovations, put up walls and take down walls and things like that, or some unlicensed plumber or something like that? Is the building unsafe? Maybe. Or staffing. Is there only like one nurse aide for 10, 12 residents, some of which are bedbound? What happens if there's a fire? So there's no minimum standards there for staffing? Maybe. Or can they not pass a background check? We require background checks for all employees who are operating in care homes in any of our facilities across the state. So maybe they can't pass a background check. Maybe they have a criminal record. Is that someone who you want taking care of your loved one? So this is the case study I was referring to. So May 27, 2022, we received a complaint about an unlicensed monster care home on Maui. And this was in the news. This is all public record, so I can talk about it. OCA investigating, we found 11 bedrooms upstairs and 10 bedrooms downstairs. 3 of the residents were in wheelchairs and 3 of the residents were bedbound, and the facility was not sprinkled. So 6 of those individuals, those ones in question, would not be able to self-evacuate in a fire. And we've seen the devastation that happened with the Maui fires. So the problem, again, just to recap, there's no oversight, no minimum standards, and no assurance. It's the Wild West. If you place your loved one in an unlicensed care home, you are taking a huge risk. It's only a matter of time till something bad happens, hopefully. Hopefully not, but yeah, hopefully there's no major wake-up call to the public about this and we can get everybody into compliance. So I get asked a lot, what can the public do? Well, you can ask the question of the home that you're looking at. Are you licensed? Ask them directly. Ask to see the license. Licenses are required to be displayed in every facility across the state. Okay, so they should have a license. And if they can't produce a license, okay, that's questionable already. And you can contact OCA to check to see if the facility is licensed. And we do also have our website posting of licensed facilities, so you can check as well. And the big thing is continue to report the people in the facilities that are placing residents in unlicensed care homes, as well as reporting the unlicensed care homes as well. So you can report the unlicensed care homes to OCA or even your representative or senator, or to the department hotline as well. So I did want to post up what a license looks like. This is actually an exact slide from my S&P presentation, but just wanted to show that the license contains a state seal, has an issuance and an expiration date, number of residents, dietary requirements. So a state license has these items on it. It's not a membership card or a group card. It doesn't say aging in place model of care. if things say that if the license that they produce says something like, oh, I'm a member of this group, or I'm certified under this group, it's not a genuine license. And they're operating illegally. So in conclusion, just to recap again, by ensuring regulatory compliance for licensed homes, OCA also ensures the health, safety, and welfare of the Kupuna and the residents in the community. But the big thing is we need access to these unlicensed care homes to ensure resident safety, to promote compliance. And the public needs to stop accepting unlicensed care. And a final thought, those who cannot remember the past are condemned to repeat it. One of my favorite quotes. You know, those instances of the fires that happened way back in the day, 50-odd years ago, I think that enough time has passed to where the public starts to forget about things like that and the horrors that can happen with these unlicensed care homes that have no regulations. So that's why the regulations are there. And that's why we do what we do. And that's why we're going to continue to fight against these unlicensed care homes. Okay, that's all I have. Thank you again for having me today. Thank you, Senator and Rep. Chun.
Thank you. Well, stick around. We have questions, I'm sure.
Yeah.
Ask, if there are questions, if you can raise your hand or like that. Or on the chat. Anybody with questions? John, you had lots of.
Type of penalties are there for violation?
Bill, sorry, I had to unmute you.
Wait,
Sorry,
one at a
Senator.
time, one at a time, one at a time. Who's speaking?
So
Wait.
sorry, Senator, this is the EOA conference room and this is Bill. He has a question.
Okay, Bill, what's your question?
What type of penalties are there for the various violations that unlicensed homes are caught with?
Penalties, Justin.
Yeah, thank you for that question. So the administrative penalties right now in statute, we were able to raise the violation fine from $100 a day to $1,000 per day of violating and operating unlicensed. So as soon as we are able to gather enough evidence against the care home, an unlicensed care home, we will issue what's called a notice of violation and order and fine them per day of operation. That's why you've been seeing these large fines in the public, in like, you know, in the news from our office. And that's because they're operating multiple days at $1,000 per day.
Thank you.
Thank you. Barbara, you have your hand up.
Yes, I was wondering, Justin, if someone becomes unlicensed because of not, performing adequately and given time to remedy the situation and doesn't remedy it, do you go to their house and take their license? Physically remove it from them?
No, I don't think we've ever done that.
I mean, why couldn't someone keep a license even though they've been shut down and show it to prospective residents?
It's possible that they could. It's possible that they could do that when we do a revocation of a license. If they were not operating satisfactorily, we would indicate in the notice of violation and order that the license is hereby suspended or revoked. We would remove them from our website, and we would order them to return it to the department. Typically, 100% of the time, they've returned it to the department. I've never had a single instance where they had kept it and tried to present it to people as still being licensed.
Okay. Thank you.
Jack Lewin.
Yeah, I just wanted to ask, how many people do you have on your team to do this?
Oh, that was a planted question, right?
We have adequate staffing, I would say, and we definitely can, utilize, resources from other agencies, and we have been. But I don't want to really divulge how many people we have working on this, Jack, unfortunately.
You can tell it offline.
Yeah, I can tell you offline.
Okay. But yeah, do you have branches on the or services on the neighbor island, or do you just travel?
We have services on the neighbor island as well.
Okay.
Good.
I do want to qualify, this is Debbie Morikawa from
Yeah.
the Department of Health. I do want to qualify though, we have enough resources and they have, Justin's section has been doing a really good job of following up on complaints in a very timely manner. However, if we were to get inundated with complaints, like let's say now that people know that we are actually pursuing unlicensed care homes more actively and following up, there could be a backlog of that. And understand that the process of issuing those notice of violations, it is a long process. We have to submit the information to our AGs review it, and Justin can go through that process, but it's not a quick turnaround. So it does, there is the AG factor. If they don't have the time to process all of these, it could be delayed even further. So I just don't want people to get the expectation that we have adequate staffing and that if there are a lot of complaints and they all start coming in, that we could respond to them immediately.
So just to build on that, Debbie, because that concerns me, because if you have a violation, they're doing bad things. I mean, and you're going to have to submit it to the AG, and the AG is, I don't know, going to do whatever they do and come back. I mean, this violation could keep on going, and poor people that are in the home would be suffering. So how do you do a quick turnaround on some of these more, I would say, to the degree you can say these are really egregious cases that you got to really move it fast? What do you do?
Justin, go ahead and share what your typical scenarios are.
Yeah.
Typically, the way that the investigations work is we would get a complaint in from a member of the public, or a resident or a former resident or family, something like that, and then we would go and investigate. We would start building our case. We have to gather evidence, and we don't take anything. We don't issue a notice of violation order without adequate evidence. We want to build a good case, and so that we're solid. And part of that process, like Debbie mentioned, is referring to our Deputy Attorney General's office to be able to consult on these notice of violation order to ensure that we have a good case. I'm a nurse by trade. I'm not an attorney. So when I look at a notice of violation order, I might think differently than an attorney would as far as the evidence goes. So sometimes we have to go back out, gather additional evidence, that kind of thing. So like Debbie mentioned, this can be kind of a longer process. It can take months.
So the average is months, or?
I don't have that data, unfortunately, offhand, but it is kind of a longer process.
And as far as the steps that we can take, once it has been determined that there has been an issue, so let's say we're talking about even the license one now, because that's what Justin is going in for, or even if you're looking at complaints, again, sometimes we're not even allowed access to it, even though by law we are allowed to. We can't just go into a home without the person's consent. So we can go take the next steps, which would be basically what Justin is, we ask the police to file to make an arrest. What is the citation? I know you said something about it's a misdemeanor, or is that explain that process again?
So currently right now in statute, it is a misdemeanor to interfere or obstruct a Department of Health investigation into an unlicensed care home.
And so what is the step if somebody does not respond? They don't let us in.
Yeah, we would need to call the police, and they could arrest that individual and charge them with a misdemeanor.
And so they charge them, but that doesn't necessarily allow us in at that point in time. So,
Correct.
it's everything is a process. So I don't want people to have the misperception that as soon as the complaint is made, we have adequate staff to actually, and that you're going to get immediate response, for that particular resident.
Have you guys worked with the AG, or I don't know which AG department you work with, but to look at the law again, because if you say you may investigate, that's so different than if you get a complaint that says blah, 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 then you shall investigate, which means you have right of entry. You know, what I mean is that it's a stronger law, and if it's a misdemeanor, well, okay, you know, it's a slap on the hand, right, kind of thing. So I don't know. Oh, I see Trisha on. The AG, I asked the AG to just listen in because we had a conversation earlier about having the AG assist in this law that was passed in, what year was that? 2018. And it hasn't really been implemented fully for the purposes of which it was passed. So I just asked them to sit in to see whether it's their department or another department of what the issue is, and you know, in terms of implementing these unlicensed these unlicensed homes that really could be hurting the people who live in it. So I don't know.
So yeah, Debbie makes an excellent point too, that when I mentioned that we have adequate staffing, I think we have adequate staffing for the workload that we have right now. And like she mentioned, if we started getting inundated with complaints, we would need additional resources to be able to investigate and take down these unlicensed care homes. But I did want to also make a caveat that our mission is not really to go after unlicensed care homes or, you know, penalize. Our mission is regulatory compliance, and we really want all of these care homes to come into compliance. We want them to apply for licensure. We want to license them. We want access, and we want to be able to, you know, show that, you know, they're being compliant with the rules and regulations and they're operating in a safe manner.
Rick, you had a question or comment?
Well, I was just wondering I put it in the chat at the beginning. What's APS's, Adult Protective Services, role in all of this? If you've got some egregious thing, somebody's being harmed, and we were to report it to Adult Protective Services, how is that different than you, and what can they do, and has that happened, and, you know, all of that? Thanks.
Yeah, thank you, Rick. That's an excellent question. And, you know, if anytime that there is a potential of abuse or neglect, even in an unlicensed care home, that's something that should be reported to the police and or APS. As far as we're concerned, there have been times where we've gone out to an unlicensed care home and it's pretty bad. And there's definitely abuse and neglect going on. And we will report that to the police and to APS at that point in time. But typically, the unlicensed care home operator will allow APS in because they get police escort, but they don't allow OCA in because we're going after them for an unlicensed operation.
Debbie, you wanted to comment on something?
Yeah, so I think to Justin's point about wanting to prevent, you know, homes from being cited and just instead be compliant. I brought this up in the PABIA meeting this morning, and I just want to reiterate that one of the challenges that we have right now, and the reason why we need to address this more holistically or systemically, is that when the laws came into play to allow for these adult residential care homes, the population was really different. So they allowed, the law basically says you can have 5 unrelated individuals who need a certain level of care, and there's a certain number of ADLs, but basically they need to be able to self-preserve. In the past, that meant ambulatory. They changed that to allow to be able to evacuate the facility in the event of an emergency like a fire. But initially it was, you had to be ambulatory. You couldn't be incontinent. And a lot of these conditions, most of the individuals, they were able to kind of take care of themselves. They just needed a little bit of supervision. That was really the level that was intended for these adult residential care homes. Well, you know that the level of care has really advanced since then, but the licensing or the regulations have not changed to require more staffing. And so you have one CNA, which is a very low bar in terms of skills, right? As far as caregiver skills, who may have gone through a 12-week training program, and now they're responsible for 5 individuals. 2, and again, there is a little higher level of staffing requirements if you're an expanded arch and you have 2 individuals that are at the ICF level. or SNF level. But for the most part, one individual caring for 5 people, just think about it. You've got 2 people that have to go to the bathroom at the same time. They need standby supervision or they could fall. And that happens quite a bit in the older adult. Or someone's sitting in the living room and they want to just go to the dining room table, but there's no one out there because you're in the bathroom. I mean, how do you manage those situations? So I think we really need to relook, and that's one of the things that Justin and I have been talking about. We really need to relook at the current regulation to see whether it's still adequate for the level of care that we're having to deal with today, because I think the population has changed significantly. So I'm not saying don't go after these unlicensed care homes. We definitely do. We definitely need to send a message out that there's a minimum standard of care that's required and that appears to only be able to be enforced through regulation. But we have a larger systemic issue that we have a population that's aging very rapidly, and it's going to continue to grow. We need these community-based care homes, but we also need them to be safe. And under the current regulation, even in a regulated care home, I'm telling you, it's unsafe at times, just because one person cannot always manage that. And so how do we deal with that? And so we need to take a look at those factors. And the other side of that is there are many care home operators, and the majority of them, I'm told by Justin, don't want to take the so-called SSD residents, the clientele that basically are getting state funding instead of the Medicaid dollars, because it's not enough money for them. And if they're not taking that clientele, there's a whole population out there that's not going to have a home available to them. So we need to look at the funding stream as well that's going to support that population in this type of environment, which is less costly, maybe not necessarily to the state, but to the taxpayer through federal dollars. It's less costly to have them in a care home than in an ICF, SNF facility. So anyway, that's my soapbox, sorry. I just really think that it's so complex. There's so much that goes into this. I don't think anybody's really wanted to take a look at it because it is very complex. But if we don't start now, we're never going to get to where we need to be.
And just mention that you're moving more into the education so that at least they don't feel like, it's a gotcha thing, or, you're going to be, hitting the penalty, that at least you start elevating their I guess their competency to take care of the people in their facility, right? I mean, you're starting to do some of that as well, the education part of it.
Yeah, we're exploring having a separate section within OCA that would strictly be for education. And then it would be not only regular in-services, but also focused education for the caregivers on deficiencies that were found during their annual inspections or their unannounced visits.
Can I make one more comment too about these unannounced visits? I think I brought it up earlier, but I'd like to present it to this group as well. I know there's a whole kind of philosophy about these unannounced visits are what's going to really catch these people, and show what the deficiencies are. We do 2 visits a year, and I really believe one should be unannounced and one should be actually scheduled. And the reason for that is, I don't know, I wasn't much of a good student, but I do know that when I knew that there was something coming up, I may wait to the last minute, but I'm going to cram to try to get all of the information I can. So I'm going to go through everything I need to do, just like in a regulation, being compliant. You're going to go through every single regulation to make sure that you're compliant, because now you know ahead of time. So you read everything. When you have an unannounced inspection and someone comes in, all you're going to be cited for is what's observed as deficient. And it's not going to be the full gamut, because there may be some things that are okay, but the person doesn't even know that they're compliant or why. They just know I didn't get cited for it. But having that one time where you run through all of it, know it, and if it happens every single year, at some point, you're going to learn what we're looking for. And most people are smart enough to figure out, hey, you know what? It's easier for me to maintain these things than it is to just try to fix it and go upstairs and, make, white out things or put things in place in the hallways the way they're supposed to be, or fix the bathrooms up the way they need to be. There is something to be said for giving them time to prepare. So I would advocate for having one that's actually a planned inspection, so they have time to prepare. And that also gives you a chance to really see, are they really capable of running a care home? Because if they have time to plan, and this is not a gotcha moment, and they still can't be prepared, then that's a flag to us that, we need to go in and maybe work with this particular caregiver more to make sure that they can be compliant. Thank you.
Yep, thank you. Any other questions? I know in the chat, it says for agencies who refer individuals to unlicensed home, is there any penalties? And yes, there are. It's in that law, right? I want to refer you to this. I don't know if Charles can show you on the screen, but this is HB 1911. It became Act what, Justin? Act
148.
148 in the year 2018. So if you go to the website for the state legislature, you can pull it up, but it has all of the penalties and it's pretty stiff, yeah, Justin. So I don't know, Charles, can you put that on the screen, or maybe you at least people know where to go. Go onto the state legislative website and look up HB 1911 go to the archives for 2018, and you'll see that law on the inspections, but the investigations are like May, so maybe that's something you might want to change. So, oh, Charles is putting it up there for you, how you do it. In 2018, HB.
Hey, Jack.
Oh,
Yeah, I'll be on the call, but maybe halfway through, I might have to move my car, so I'll be on my iPhone.
Don't worry
Okay.
about it. Sorry. Yeah, I got it. I got it.
Thank you.
Yeah, thanks.
Okay, so that's, if you can look at that, that is the law right now. They can investigate if there's if they have complaints or they're operating without a license. And then there's all these increased penalties. What was it, $1,000 a day if you're unlicensed? There's also penalties for people who refer to these unlicensed facilities.
And so we want to thank the Kupuna Caucus for that, because actually it was part of the Kupuna Caucus package.
So maybe we have to relook at it, Justin, yeah, make it stiffer.
Yeah, I'm going to have to agree with you on that one.
So I asked Trish Nakamatsu, who used to be the prosecutor's office. Now we're so pleased with the AG's office, to just listen in, because I said there are real concerns because this law, 2018 law, hadn't been implemented in a long time, which sounded good at the time, and to see what can be done. And we can work on it. This is the start of a conversation. So hopefully to get the right people to help put it together. But Trish, you have any comments? I know this real last minute, I said, just listen in, but in terms of like enforcing the law. Oh, are you on mute? We can't hear you. How come, Charles, how come she's on mute?
Okay, is that
Oh,
better?
there. Okay.
Okay,
Yeah.
sorry about that. I'm not that familiar with specific areas of unlicensed care homes. I did note that in 2023, one of the criminal provisions was repealed, I think, to provide more focus for the administrative enforcement mechanisms, was what was in the bill. So it sounds like the administrative enforcement is really starting to take effect, and that's good to hear. But from the criminal side, if there's things, abuse or neglect, things like that, there could be other criminal penalties that could be imposed, but they wouldn't necessarily be right on point with unlicensed care homes that I'm aware of.
Mm-hmm. So I think, what brought to light when we had this, we had a meeting prior to this, is that this is the start of a conversation, because we're looking at how can you fix this so that we have no unlicensed homes, zero tolerance, and the way to do it either education-wise or being able to inspect, but inspect in terms of trying to get them to be licensed. So, looking at what are some options and do we need to change the law so that it's clearer, and not just a gotcha law, but really one that we're trying to get all facilities to be meeting standards of care.
Right. And thank you, Senator, for asking us to be here. I'm personally part of the Criminal Justice Division. We do have deputy AGs who advise DOH, for example, and other divisions that we could speak with, those deputy attorney generals as well, and see if there are other ideas
That'd
on
be great. So
enforcement.
I think this is the first step, and then we could bring back Justin and Debbie and some like John who have direct knowledge of some of these homes and what can we do to close the loophole in a more productive way, more, because we don't want to lose the care homes. I mean, if they have a place for people to go, we want to increase the number of community-based care homes. So, how do we help them make it livable, I guess?
We at CHIPTA also have, we collect data from them. We know how many, we chronicle all the various healthcare services and facilities around the state, keep track of all of that.
Okay, so maybe you should have a conversation too, Jack.
And we sometimes there's some troublesome entities that don't report. And so, we send them letters saying we need to figure out what's going on. Are you still operating? What are you doing? How many beds you have, etc. There's always a few that just seem to be in a mysterious kind of state of kind of wonder whether they're fully functional. So I mean, that's why I'm gonna meet with the OCA team, Debbie and the OCA team sometime soon, just to sort of talk about some of those issues.
Good.
Yeah.
Okay. Audrey also has her hand up. Audrey.
Yes. Hi. I wanted to just make a comment. I really appreciated what Debbie was talking about, having standards of care and talking about the importance of staffing. And this issue actually also applies to the nursing home industry. And I'm not sure if everyone knows, I know this was brought up in the PBIA meeting today, but the nursing home CMS has just issued some regulations, administrative regulations of having minimum staffing for the nursing home across the country. And, this is long way overdue, but of course, there's some pushback on this right now, which is raising some concerns for ARP. But this issue about staffing, for having minimum staffing for standards of care and really upholding the safety, not only for the residents, but also for the staff themselves, is so important. And so, I think we need to have this conversation, continue on, making sure that the whole spectrum of continuum of care, from the nursing home industry to the home and community-based services, as well as to the care homes and then the home and community-based services, because it all affects workforce and having quality care and making sure that we can meet the needs. And of course, the pushback we always get is that, it costs so much to attract these people. We're competing with the nursing, with the hotel industry, and the compensation is poor and whatever. But nevertheless, the issue is right at facing all of us, that we don't try to solve this problem and tackle it in all these different facets of it, then we're really going to be up the creek when we have an aging population that needs the care. So, this is just the start of the conversation. I know that the feds are trying to do something with the nursing home, but it also starts applying down to all the different levels of care. I just wanted to make that comment.
No, important. We really need to staff up, but everybody's stealing from everybody else, and so we really need to develop a pipe stream, a stream for getting. Maybe we were looking at internships for high school kids to get more interested in direct service. I'm going to ask Caroline. Caroline, you had your hand up.
Yeah, we put our questions, Senator, into the chat. Those in the room just wanted to know, do we have data on how many citations were given to referrals to unlicensed facilities?
Justin?
I don't have that data offhand right now, no.
Can you get us
Okay.
so that we know the extent of the problem? That would be good. Or not.
Anecdotally, it is a problem. And it's a significant problem.
Can you just give citations for not letting you go in to inspect, so that, that might be one way of getting some inspection entry?
Well, the it would be a misdemeanor at that point. So that's something where we would need to work with either law enforcement or the AG's office on to issue that misdemeanor, because the Department of Health can't issue a misdemeanor. We threaten the misdemeanor, and typically they'll let us in, and we'll give them a copy of the Act 148, and they'll see that it's law. Oh, wow, I can't keep you from coming in. And then they'll typically let us in. But we have been obstructed by some unlicensed care home operators who have a large group of people that they work with, and also attorneys that they work with as well.
But the law is the law, right?
I agree, but some of these attorneys still try to find ways to circumvent it.
Okay.
Absolutely, John.
Okay. Okay, Rick?
Well, on lines of laws, how about that House Bill 490 when we pass that? Any abuse and the penalties that come with that. Is that more teeth that we could possibly be using? I mean, it's bodily harm or forgery or theft. I had a case where the client was actually duct taped to the bed and was really doped up and looked like she'd been abused. And we called it in. That was before House Bill 490. But I mean, does that help? I mean, we've passed some bills here to make it easier to get folks that are, causing harm to folks 60 or older. So I'm not just saying the unlicensed, but this unlicensed home doesn't come with not being trained, and they're more likely to abuse the clients. And we've certainly seen that.
Yeah, you bring up a good point. And I think as we go forward, as I said, this is the first of a conversation that started with, us talking about the unlicensed. But if you're looking at looking at it comprehensively, we should look at all laws on the books and see how they all come to bear on not just unlicensed homes, but just standard of care in homes. And that way you can look at some of these other bills that might come into play. And I think that's where maybe the AG's office, whoever is working with you, or maybe we can get the criminal division involved to look at, how we can put this together as a more comprehensive, looking at caring for our elders in homes kind of thing. Yeah. Kelly, you had your hand up.
Yes, I just wanted to reiterate what Audrey talked about. So I don't know if it's better at a different part of your agenda under new items. So it really relates more to the CMS nursing standards for staffing, for nursing homes, and would like to talk about that a little bit more and get, we have both John and Justin and Debbie on board, but would like to at least see if maybe that would be something that makes sense for a future agenda item for a deeper dive on that issue, but would love to talk a bit more about that now. But you let me know when best in the agenda, Senator.
Okay. So let's see, do we have anybody else who wants to talk about care homes and licensing of care homes and inspecting care homes? Anyone want to last few minutes for this discussion? And really thank you so much, Justin and Debbie, because it's been very enlightening, and the history and where we are today and how the population has changed and grown, and how we really need to get in front of this instead of behind it. So the kinds of things your folks have been talking about is great. And so I'll leave it up to you to tell us if you want to meet, or we can put it together for you with well, if Kelly has some other things to add to it, but also with the AG's office and with Jack, your SHPTA.
Yeah. Okay.
Yeah. So we can put that together for you guys, or if you folks want to take the lead on it, but we can keep on going so that hopefully by next session, if there's some corrective action on the bills, we can tweak it some more, make it stronger, or see some ways that you can enforce better in terms of these inspections. Anybody else last time? Okay.
Well, hi, this is Winnette Gaylord. I'm speaking on behalf of the licensed care home industry. We definitely support OCA in doing whatever necessary to close down the unlicensed care homes. We as licensed care homes do follow certain regulations, chapter 100.1, and we welcome the ombudsman and also our nurses to come in and do our inspections. So we do definitely back Justin on behalf of the licensed care home industry. Thank you.
Very good. All right. Thank you, Justin. Thank you, Debbie. Appreciate your doing all of this for us. And we will keep in touch. Okay.
Thank you, Senator. Thanks for your continued support.
Thank you.
Thank you.
So, all right, Kelly, you can talk about CMS and what the new regulations are or how it might help us.
Okay, I actually don't mean to jump over Audrey too, who is available for this particular issue as well. I'll just provide the more federal perspective of what we see happening in Congress related to this. So CMS issued their rules earlier this.
Hold on.
Hey there, Jack.
Hold on 1 second. Can everybody go on mute so that we don't have feedback?
Okay, so CMS earlier this year issued their minimum standards for staffing requirements in nursing homes. And what's happening right now in Congress is the nursing home industry is pushing back rather heavily on those standards. Part of that has to do with the cost related to it and other issues, and I don't want to get into the nitty-gritty of that. The challenge right now, though, in Congress is primarily states that are red, for lack of a better term, have introduced what's called a Congressional Review Act, which is a way by which the Congress can override an administrative rule issued by the president. The challenge right now, or the concern, is that there are quite a few Democratic congressional delegates that are a little bit squishy on this issue of the CRA. The reason the CRA is a problem is that if it does pass and cannot be vetoed by the president, it will tie the hands of CMS for the future to be able to issue any rules regarding nursing home staffing standards. So it is a significant issue, and it's a real one. And I say it's a real one because ARP nationally is looking to have all the state offices meet with our congressional delegation and not have Hawaii's delegates at all vote in favor of that CRA. The reason I'm bringing it forward is our delegation, all of them, I think, very much so support the staffing standards. The concern really for Hawaii in particular is how will that impact our rural nursing homes? So what we're hearing is that the number of beds are going to be reduced, that facilities could be closed. And the concern really is that these standards are absolutely correct. They are meant to ensure quality service and ensure that residents who are in these nursing facilities are getting the proper care. Research and study has shown the number of nurses and CNAs in a nursing home have direct correlation to the quality of care for the residents. Now, Hawaii is in a good situation because we tend to have really high number of staffing compared to other states. It might not meet the standards, but we're pretty close or exceed them in some places. Now, again, for our rural areas like Hawaii Island and Kauai, that's a lot more challenging maybe at times. And in our discussion with the Healthcare Association of Hawaii, they've made it clear that the biggest challenge really is in the area of CNAs. The upside of that is the entry barrier for that is less than an LPN or RN. Anyway, we wanted to bring it to this group's attention because we think our congressional delegation has to hear from more than just ARP, but want to just get a better sense from, Justin, Debbie and John and whoever else again, this is in the nursing home area, not ARCHs or CCFFHs and the like. So just wanted to bring that forward. Audrey, have I left anything out or anything you think that this group needs to know about to better understand where we're coming from?
No, I think you covered it correct, completely. So yeah. We just want to try to get a sense of it. I mean, definitely I think Hawaii is doing better than many other states, but there's always room for improvement. And, we just want to make sure that our residents are receiving the best care and that there's, adequate staffing to provide that type of care.
Senator, you're muted. Senator, you're muted.
Oh, sorry. So is there anything that this group needs to do to help the situation, or it's sort of mulling over in Congress? What is the situation there? Or do we need to do anything here?
I think it would be helpful. So my thought is that it'd be helpful for our congressional delegation to hear from the caucus. I don't know what the caucus's process is, though, for determining what action it will take. So if there's a way to get letters or meetings with our congressional delegation, whatever the case may be, we do know they're on recess right now, so there's a little bit of time. But I do know this CRA will be taken up once Congress returns to session in September. Again, overwhelmingly, this is primarily a Republican issue. The problem is that there are Democratic congressional delegates that are, for lack of a better term, squishy. They're not clear. They, again, support the staffing requirements. Our congressional delegation absolutely sees the benefit and understand why those standards are required. Their concern is around implementation and potential closure. So the issue for us, and I don't know if that's more a Debbie and John or Justin thing, but I think they need to hear from us that those standards are important and that we, including the legislature and the Department of Health and folks, will work with the nursing home industry in Hawaii on the implementation process. Basically, they're given 3 years for our non-rural nursing homes to work through meeting those standards. Our rural areas, Hawaii Island and Kauai, have 5 years. I think hearing from you folks that there is work that's being done on the workforce development part, and what other strategies are being considered out there would be very helpful. So again, I would really encourage and would love to have our congressional delegates hear from you folks about why those standards need to be done, that you're open to working on the implementation, and that a Congressional Review Act is the worst thing that could happen, because the fact that CMS would no longer be able to develop standards would be problematic.
Kelly, this is the first time that's brought to our attention
Right.
at the caucus. So what would help is for you to briefly say, this is what the CRA is, this is what it will do, and then we can circulate it among the members, and also especially to the agencies that implement, like OCA and SHPTA, and see how we would fashion something like that, because we've never really sent a letter to the congressional delegation from the Congress.
Absolutely understand. And that's why I wanted to at least start it here and maybe see if we could get it on the agenda for September. Absolutely. Okay. That would be the date, presuming Congress doesn't take it up before your next meeting.
Okay. So if you can send the information, we can at least circulate it before you present, and we could have you present, and if we can do it earlier, we could do it earlier, and you can look at what the timeline is for when Congress will take it up. So, okay.
Thank you.
So keep in touch and let us know in the timing of this. And if we have to do it earlier, we can do it earlier. If not, we wait till the next meeting, and we should certainly put you on the agenda for the next meeting.
Thank you.
Thank you. Anyone else? Okay, so next meeting is September 6th, Kelly.
Yep, got it on my calendar. Thank you.
Okay, and so we will have that on our agenda the next time. And if anybody else has any other issues that are pressing or would like to see us discuss, we could do that as well. Rick, yes, Rick, hearing aids?
So I just sent you an email. Brought this up on Pabia, but Meals on Wheels of America has contacted me us a couple of times. They just contacted me last week. There's an $8 billion cut about to happen to nutrition programs nationwide that we really need to pay attention to it. So I sent you, there's three. There's March's original alert, a link that I sent, and I sent it to many folks on here. And then also July 24th, it's kind of coming up, and we're hoping that it doesn't happen. It's quite a bit of money. So I sent that to you and just emailed it. I'll stop there because I know we're kind of going over time. So just take a
We'll
peek.
send it around to everyone, and if there are some issues still pending, just let Charles know. We can add that to the agenda for the September 6th meeting.
Okay. Thank you.
Okay, thank you. I think we have come, we're overtime. So if there is no other, are there any other announcements? Okay, so I'm going to adjourn this meeting. Corey, you want to add anything? My partner here.
No, I just wanted to say thank you to Justin and DOH for the presentation.
Very good presentation. Thank you so much.
Thank you, Corey. Thank you, Senator, too.
All right, thank you. Okay, aloha.